Hi, my name's Leah and I'm the National Education Specialist for INSKIN Cosmetics. Today we're going to be walking through the correct procedure for skin needling or collagen induction therapy so that you can make sure your client sees great results. We will be starting with a really nice thorough cleanse of Rachel's skin. It's important that we remove all traces of makeup from the skin because it's really important to not be pushing any pigment into the skin during the needling treatment. It's also important to be using an oil-free cleanser on the skin because anything that has an oil in it can affect how your local anaesthetic cream works. Your treatment area. Remove your sterile field from the container. Everything on the inside of this packet is sterile, so it's important that we remain that way throughout the whole treatment. First thing we can do is use the first pair of tweezers to remove the paper towel, the other tweezers, the gauze and the cotton balls from your container. Now you've touched those tweezers, they need to be discarded. The next step is to place your saline solution and chlorhexidine into your little dishes. The contents of these containers are sterile, however the containers themselves aren't, so they need to stay outside of your sterile field. We also need to decant the products that you'll be using during the treatment. The first step is to remove and decant your Pure Age Defiance serum, which is what I'll be applying directly after the needling, and I'll also be finishing off with Mineral Pro to protect against any UV radiation. To prepare our rolling device today, I'll be using the 1mm DNC roller. So the unit itself is sterile. We can remove the protective cap, and it's really important not to place those needles onto a hard surface, so just rest them on the edge of your tray. The last step is to put on your sterilised gloves. So these will have a particular glove for the right and the left hand, and once you've donned these gloves, it's very important not to touch anything that isn't sterilised. So to begin the treatment, I've got some chlorhexidine on a cotton bud here. It's really important that we squeeze out the excess from that so that we can get a good removal. So with that, I'm going to start removing the first section of anaesthetic cream from Rachel's skin. So I'm going to be starting on the forehead. So when we're starting the treatment, it's important just to do a little test roll before we start to make sure that the anaesthetic cream is activated. So I'm just going to lightly roll that on your skin. Can you feel that, Rachel? No pain or anything, just a bit of pressure?
Yep.
Beautiful. When we start rolling, our index finger rests on the finger pad. This makes sure that we get a nice even pressure. We support the skin. We roll backwards and forwards 4 times and then move on to the next section. What we're looking for with this treatment is a light petechiae, which is a technical word for blood coming to the surface of the skin. Once we've rolled in this direction, then we come back in the opposite direction. Still supporting the skin and working methodically. We can see we have good petechiae here, and there's still a little bit more work to do here, so now we can just go back on those areas. Once you've achieved a nice even erythema, you can use a cotton ball with saline solution to remove those petechiae from the surface of the skin. It's important that you remove that petechiae after each section, because otherwise the blood is allowed to dry in the wound, which can mean that your clients will have red spots the next day. Once you've cleaned the area, you can apply your serum, so in this case Pure Age Defiance serum, liberally over that area. So we've achieved a nice even petechiae. Saline to clean the area and apply our serum. So Rachel, what you'll probably start to feel is as that inflammation sets in, your face can feel a little bit like it's pumping because the blood's working. So I'm going to move down onto the cheek now. So when working around the eye, you can get your client to look up for you. Stretch the skin down so that you can be supporting over the orbital bone. And it's just very, very, very light pressure working around the eyes. We know it's much finer skin, so we just let the roller do the work. I'm always looking for a nice even redness, so if there's a little spot like this that isn't as treated, then we can just work back over that. So your lip and the chin. So to finish, you can apply your serum all over. It's important not to put any active ingredients like vitamin A onto the skin. Hyaluronic acid is your best option.